Welcome to the program, everybody. I'm David Gregory. The miracle of liposuction to many is that it is a simple and effective way to lose the weight that so many can't seem to keep off. But a front-page health alert on the USA Today reports alarming danger signs. According to a new survey, I want to start today with Dr. Loftus, who is a plastic surgeon and knows something about this. Why is this rate so high? What's going on here?
Well, we think that the rate is high because for a number of reasons. One, liposuction is very common. Liposuction is the most common cosmetic surgery procedure, and therefore, if there are any deaths, they're going to be higher just by virtue of the fact that that is the most common procedure. Also, I think that to an extent, there are a number of complications out there that can quite frankly be prevented and need to be prevented.
Is it that... you know, there was a point that was made in the article about this being a seductively simple procedure, and that in some ways that may cloud the judgment of people who are going in who may not be the best suited to have the procedure done.
I agree. Liposuction, some people consider to be quite a simple procedure, and that is the most dangerous conclusion that people can draw. Although the incisions are very small for liposuction, the surgeries are often quite large. A large volume liposuction can be one of the largest and perhaps most risk-provoking procedures that we have. It is very deceptively considered a small procedure.
Why is this procedure happening so frequently outside of a hospital? Why is it happening in offices, and why is it billed as such a simple procedure?
The procedure is commonly performed outside of a hospital, as are many cosmetic surgery procedures performed in the doctor's office. And as was already mentioned, the fact that office surgery is so unregulated in this country is perhaps one of the greatest reasons that we're having so many problems.
All right, but so what's happening then in these cases where somebody's dying? I mean, what goes on? I mean, the process of liposuction is to suck the fat out of the body. Take us through the process and where something's going wrong.
Right. Well, during the procedure, a patient is anesthetized, either put to sleep or sedated. Small incisions are made, and then fluid is infused into the area which is to be liposuctioned. Rods, or as plastic surgeons call them, cannulas, are then used to move through the fat to gently suction it out. During that process, a number of things are happening. Number one, the tissues are being traumatized, and whenever you traumatize tissues, the body responds to that by producing a lot of fluid in that area. Essentially, very large wounds are created underneath the skin. Also, the whole process of the procedure is somewhat stressful for people, as is any large operation. You had mentioned what are the things that cause people to die following liposuction. Right. The number one cause is something called a thromboembolus, and put in common terms, that is basically a blood clot that forms in the leg during not just liposuction but any large procedure, and that can break free and travel through the blood system and lodge in the lungs. When it does that, then it becomes difficult, or depending on the size of the clot, sometimes impossible for the person to actually get oxygen into their bloodstream, and they die essentially of suffocation because of that.
Let me cut you off here. We're going to take a break. We'll continue with this one. Let me formally introduce my guest. I'll get to your phone calls. In Cincinnati, Ohio, it's Dr. Loftus. She's been on the program before. We're happy to have her back. A plastic surgeon and the author of The Smart Woman's Guide to Plastic Surgery. Sharon on the line from New Jersey. Sharon, go ahead quickly.
Yes, I'd like to know what is the maximum amount of adipose tissue that should be removed at one time, and how I can find a plastic surgeon for breast surgery and get a detail of it before I choose the surgeon. Thank you.
Dr. Loftus, you have about 30 seconds to answer that.
Excellent question. The appropriate amount to be removed from any individual varies from person to person and what the situation is. That needs to be discussed with your surgeon. We do feel that the more that's removed, the greater your risk. As far as finding a surgeon, I would suggest your best bet is to find a surgeon who's certified by the American Board of Plastic Surgery, and you can find that through the American Society of Plastic and Reconstructive Surgeons.
All right, got to take a break here. A news update next. We'll have more on this.